White fluorescent light, stainless steel, the hum of overhead vents. The surgical prep room smells like iodine and sterile plastic. Sharp, clinical, the kind of smell that clings to scrubs and skin long after a shift ends. County Memorial's pre-op bay. 6:47 in the morning. The kind of quiet that doesn't last. A woman in faded scrubs moves through the space. Late 30s, hair pulled back tight. No jewelry, no nail polish. Hands scarred in places scrubs don't cover. Her name is Maya Reeves, surgical technician. Second shift, invisible. She preps instrument trays with the kind of precision that goes unnoticed. Each tool angled, each count exact, each surface checked twice. Her fingers move across scalpels and clamps like she's reading Braille. Weight, balance, edge condition. She knows them all without looking. The door swings open. Dr. Evan Calloway enters. 29, confident, freshly minted attending surgeon. White coat still stiff with newness. He walks like someone who just discovered he's in charge. He doesn't look at her. Tray for the inguinal hernia? Bay 3, already counted. He walks past without acknowledgement. His shoes squeak on the tile. He's halfway to the OR before the door swings shut behind him. She's used to it. Another surgeon brushes by. Dr. Linda Ortiz. Older, sharper. 20 years of trauma under her belt, and it shows in the lines around her eyes. Maya, the sharps count was off yesterday. You need to stay focused. It wasn't off. I recounted twice. Radiology found the needle in the drape fold. Ortiz pauses, just for a moment, then shakes her head. Just pay attention. Maya says nothing. She turns back to the tray. Her hands don't shake. They never do. Not anymore. No one asks how she knows instrument weight by feel. No one wonders why her counts are always perfect. No one sees the way she watches the monitors during surgery. Reading vitals like a second language. A nurse drops a clamp. It hits the tile with a sharp metallic ring. Maya's hand snaps out, catches it mid-bounce before it skitters under the cabinet. A nurse blinks. Whoa, fast reflex, just got lucky. She sets the clamp in the disinfectant tray. Doesn't meet the nurse's eyes. Her left wrist, barely visible under her sleeve, carries a thin, faded scar. Straight line, surgical precision, not self-inflicted. Something else, something old. She's been here 18 months. No one knows where she came from. No one asks. The intercom crackles. Trauma incoming. ETA 4 minutes. MVA, unstable vitals. Maya doesn't flinch. She moves to the trauma bay, pulls gloves from the box, checks the airway cart. O2 tank full. Suction working. Intubation kit ready. Her hands move through the checklist like muscle memory. Calloway enters behind her, tying his surgical gown. You don't need to set up for traumas, Maya. That's the nurse's job. I'm here. Might as well help. He huffs. Doesn't argue. Just moves to the sink and starts scrubbing. The other techs file in. Younger. Louder. They joke about last night's game while pulling on gowns. Maya stands to the side. Silent. Watching the empty bay doors. Waiting. Ortiz enters. Gloves already on. What do we know? Male mid-40s. T-bone collision. Steering wheel impact to abdomen. BP dropped en route. Maya's eyes flick to the monitor. Still blank, but in 30 seconds it won't be. The distant wail of sirens grows louder. Calloway positions himself at the head of the table. Ortiz on the right. Nurses flanking. Everyone. Everyone in place. Maya stands near the instrument tray, close enough to help, far enough to stay invisible. The ambulance bay doors burst open. Paramedics roll a gurney through. A man, pale, sweating, bleeding through abdominal dressings. His breath comes in short gasps. BP's 80/50 and dropping. Pulse 130. Abdomen's rigid. Get him on the table. They transfer him. Fast. Practiced. The monitors flare to life. Numbers climbing and falling. Alarms waiting to scream. Calloway cuts away the dressing. The abdomen is distended, bruised, rigid as a board. Likely splenic rupture. We need to open him. Prep for X-lap. Maya, get the laparotomy tray. She's already moving. The tray comes from the warmer. She checks the instruments by touch as she wheels it over. Scalpels, retractors, clamps, everything in order. Her fingers brush the retractor handle. Cold steel. And for half a second, she's somewhere else. Desert heat. Dust in the air. The roof of a field hospital tent flapping in the wind. Voices shouting in another language. Her hands, younger but steadier, holding a retractor inside a soldier's abdomen. Someone screening for more pressure. Blood pooling faster than gauze can absorb. Reeves, clamp, now. Her hand moves without thought. The bleed stops. Silence. Maya blinks. She's back. The tray is in position. No one noticed the pause. Calloway is cutting. Ortiz is suctioning. Blood wells up and gets pulled away. Spleen's shredded. We're taking it out. Maya watches the monitor. Heart rate climbing. Blood pressure falling. Her jaw tightens. Clamp. A nurse hands it over. Calloway clamps. Cuts. Pulls. There. Controlled. But the pressure keeps dropping. Doctor, I've got it. His BP. I said I've got it. Maya's hand clenches once. Then releases. She steps back. She's learned when to speak. And when silence is safer. A nurse glances at her. The same one who saw her catch the clamp. You saw something. Doesn't matter. You always see something. Maya doesn't answer. The patient stabilizes. Barely. The numbers hold. Not good, but not crashing. Calloway closes, strips his gloves. There's satisfaction in his movements. The confidence of someone who thinks he just won. Good work, everyone. He walks out. Ortiz lingers. She's watching Maya. Has been for the last 2 minutes. You wanted to say something earlier. No, ma'am. You're a terrible liar, Maya. Maya meets her eyes, just for a moment. He got the bleed. That's what matters. Ortiz nods, but something in her expression shifts. Curiosity, suspicion, respect. Maybe all three. She leaves. Maya strips her gloves, turns toward the door. Her hand brushes the edge of the instrument tray. Muscle memory. She adjusts a scalpel, half a degree, without looking. Small, automatic. Ortiz sees it from the doorway. She stops, turns back. Where'd you work before here, Maya? Couple places, small hospitals. Which ones? You wouldn't know them. Try me. Maya walks out before Ortiz can push further. She's careful. Always has been. She heads down the hallway, past the nurse's station, past the vending machines, to the locker room at the end of the hall. Empty. She opens her locker. Inside, a photo, folded, creased at the edges. She doesn't take it out, just looks at the corner. 5 faces, desert fatigues, smiling. She closes the locker. 18 months since she walked away. 18 months since she swore she'd never go back. Her wrist itches. The scar. She pulls her sleeve. Ved down, turns, leaves 2:17 in the afternoon. Post-op recovery bay. The light is softer here, less clinical. Monitors beep in steady rhythm. Patients sleep off anesthesia. Nurses move between beds with quiet efficiency. Maya restocks the crash cart in the corner, checking seals, rotating medications, counting supplies. The kind of work that keeps her hands busy and her mind occupied. Calloway reviews charts at the nurse's station. Relaxed, confident. The hernia repair went well. The trauma patient from this morning is stable. It's been a good day. A monitor beeps. Then again. Then continuous. Doctor. Calloway's head snaps up. The hernia patient from this morning, the one he closed clean. Vitals plummeting. What the hell? He's at the bedside in seconds. Maya drops the supplies and follows. Ortiz rushes in from the hallway. What happened? I don't know. He was stable. The patient's skin is gray, lips tinged blue. Blood pressure 60/40 and falling fast. Heart rate climbing into the 140s. He's in shock. Push fluids. Already wide open. Internal bleed? I closed clean. There's no way. Calloway pulls back the gown. Checks the surgical site. No blood. No swelling. Nothing. It's not the abdomen. Calloway doesn't hear her. Get a CBC, type and cross. Call the blood bank. Doctor, it's not the abdomen. Then what is it, Maya? Tension pneumothorax. Left SARD. Everyone stops. Ortiz turns to look at her. He's not showing respiratory distress. Not yet. But his trachea's deviating. JVD starting. You've got maybe 2 minutes before he codes. Calloway stares at her. Disbelief written across his face. You're a surgical tech. You don't diagnose. Check his chest. You'll see it. Ortiz hesitates, then moves to the patient. She pulls the gown aside, palpates the neck. The trachea is shifted slightly to the right. Jugular veins distended. The left side of his chest. Subtly fuller than the right. Jesus, she's right. That's impossible. He didn't have chest trauma. Rib fracture. Delayed pneumothorax. Happens in high-impact MVAs. The fracture punctures the pleura hours after the initial injury. We need a chest tube. Now. I'll call thoracic. There's no time. She's already moving. Gloves on. Betadine from the crash cart. Scalpel. Her hands move with the kind of speed that comes from repetition under pressure. Maya, stop. Let her work. Maya doesn't wait for permission. Her hands remember what her mind tries to forget. She palpates the fifth intercostal space, finds the landmark between ribs, marks it with her finger. Scalpel. One clean incision. Straight line. 2 inches. Blunt dissection with a Kelly clamp. She spreads the tissue, muscle, fascia, down to the pleura. She punches through. A hiss of air, then a rush. The patient's chest deflates slightly, pressure equalizing. Maya threads the chest tube, smooth, fast. No hesitation. She advances it into the pleural space, connects it to the suction canister. The monitor changes. Heart rate steadying. 140, 130, 110. Blood pressure climbing. 70/45, 80/50, 90/60. He's back. Maya steps away, strips her gloves, drops them in the bin. Her hands are steady, but her breathing isn't. She walks to the sink, washes her hands, slow, methodical, giving herself time to come back. Calloway stares at her. How did you? I've seen it before. Where? Maya doesn't answer. She dries her hands, turns toward the door. Ortiz steps. Eps in front of her. Maya, where did you train? I need to restock the cart. She walks out, but the room doesn't forget. The nurse who handed her the scalpel is still frozen in place. That wasn't normal. No, it wasn't. Calloway looks at the patient, then at the door Maya just left through. Who the hell is she? 4:38 in the afternoon. Staff break room. Maya sits alone at a corner table. Coffee untouched in front of her. Her hands rest flat on the surface. Still, controlled. The door opens. An older man enters, late 50s, graying beard, worn jacket over a flannel shirt, visitor badge clipped to his collar. He's here to see someone, a patient probably. But he stops when he sees her. His face changes. Recognition. Reeves? Maya doesn't look up. Wrong person. Sergeant Maya Reeves, 274th Forward Cervical Team. Her jaw tightens. You've got the wrong person. Kandahar, 2016. You were the trauma specialist who kept my son alive long enough to make it to Bagram. Maya's hands curl into fists on the table. I don't know what you're talking about. He steps closer. His voice is softer now, thick with emotion. He told me about you. Said you worked on him for 40 minutes under mortar fire. Said you didn't stop even when the tent got hit. I'm just a surgical tech. You've got the wrong person. You've got the same scar. Right wrist, shrapnel wound. He told me about it. Maya's hand moves instinctively to her wrist, covers it. The man's eyes fill. He made it home because of you. I never got to say thank you. His voice breaks. So thank you. He turns and walks out, but the door doesn't close fast enough. Ortiz is standing in the hallway. She heard everything. Maya sees her. Their eyes meet. Dr. Ortiz, don't. Ortiz turns and walks away. And just like that, the wall cracks. 6:15 in the evening. Nursing station. Whispers. Did you hear? Ortiz says she's military. Like enlisted? Like special forces or something. Trauma surgeon in a war zone. Calloway overhears from the charting desk. That's impossible. She's a tech. Ortiz passes by. Is it? She doesn't have the credentials. She has the skills, Evan. That's what matters. She lied on her application. Or she walked away from something you can't imagine. She keeps walking. By midnight, everyone knows. 11:42 at night. Locker room. Maya stands in front of her locker. The photo is in her hand now. 5 faces. Desert fatigues. Smiling. Young. Only one still alive. Her. She closes her eyes. The thing about running is that the past runs faster. She folds the photo, puts it back, closes the locker, turns off the light, leaves. 3:27 in the morning. Trauma bay. The hospital is quieter at this hour. Skeleton crew. Dim lights, the hum of machines filling the silence. Maya wipes down instrument trays. Methodical, precise, giving her hands something to do while her mind refuses to settle. The intercom crackles. Mass casualty event. Warehouse explosion. ETA 2 minutes. All available personnel to trauma. Maya is already moving. She doesn't run, doesn't rush, just moves with purpose toward the supply room. Pulls extra gauze, extra chest seals, extra everything. Calloway stumbles out of the on-call room, hair disheveled, eyes half open. How many? 12. maybe more. He's awake now. Ortiz appears from the stairwell, fully dressed. She never really sleeps during shifts. Nurses flood the bay. Techs, residents, everyone who heard. Heard the call. The doors are open. Waiting. The first ambulance arrives. Sirens cut off. Doors fly open. Paramedics roll a gurney through. A man, early 20s, covered in soot and blood, burns across his chest and arms. Breathing shallow. Crush injury to the chest. Possible flail segment. BP 90/60. Bed 1. They transfer him. Move to the next. Another gurney. A woman. Unconscious. Penetrating trauma to the abdomen. Metal fragment still embedded. Bed 2. Another. Another. The bay fills with chaos. 12 patients. Too many. Too fast. Calloway tries to organize. Red tags to OR1. Yellow tags 2. There's no time for tags. A monitor alarms. Then another. Doctor. Calloway spins. Tries to prioritize. His hands hover over a patient. Then move to another. Indecision flickering across his face. I can't. Evan, focus. But it's too much. A patient crashes. Flatline. A nurse starts compressions. Another patient's oxygen saturation drops. Turning blue. We're losing them. Calloway freezes, just for a second, but a second is too long. Maya watches from the corner. 3 seconds. That's all she gets herself. Then she moves, not like a tech, like a commander. Stop. Her voice cuts through the noise. Everyone freezes. You, airway on bed 2. You, chest decompression, bed 5. Ortiz, sucking chest wound, bed 1. Calloway, crush abdomen, bed 3. Calloway turns to her. You can't just, I just did. Move. Ortiz doesn't hesitate. She moves to bed 1. The others follow. And for the first time in 18 months, Maya Reeves stops pretending. She's at the center of the storm now, directing, prioritizing, moving between patients like she's reading a battlefield. Bed 4. Tension pneumothorax. I need a 14-gauge needle and a tube kit. She doesn't wait for anyone to hand it to her. Palpates the chest. Finds the second intercostal space, mid-clavicular line. Needle in. A hiss of air releases. The patient gasps. Color returning. Get me a chest tube. Now, a nurse scrambles, brings the kit. Maya decompresses the chest fully. Inserts the tube. Connects suction. Next, she moves to bed 6. This one's bleeding into his pelvis. Unstable fracture. Get him to OR now. We don't have room. Make room. She moves again. Bed 8. Airway compromised, swelling from smoke inhalation. She intubates. Fast. Clean. No hesitation. Bag him. Keep the O2 at 100%. Bed 9. Bed 10. She's everywhere. Calloway watches her from across the bay. His hands still on a patient's abdomen, holding pressure on a bleeder. His voice is barely a whisper. Who are you? Maya doesn't hear him. She's already saving the next one. 4:02 in the morning. Outside, the sound of rotors. Low, heavy, growing louder. A Black Hawk helicopter descends onto the hospital's helipad. Dust and wind whip through the ambulance bay, spotlight cutting through the dark. The side door opens before the skids even touch down. A man steps out, dress uniform. Crisp, immaculate. Silver oak leaf on his collar. Lieutenant Colonel James Garrett. He walks into the ER like he owns it. Nurses stop, stare. He doesn't acknowledge them. Where's Sergeant Reeves? The charge nurse blinks. I don't think there's anyone here by that. Trauma bay. Now. He doesn't wait for directions. Trauma bay. Garrett enters. The chaos has calmed slightly. Patients stabilized. Some move to OR. Some still critical, but controlled. He sees her. Blood on her scrubs. Hands. Nen's moving over a patient's chest. Face focused, intent. Reeves. Maya's hands stop. She turns. Her face goes pale. Sir. The room goes silent. Everyone's staring. You're a hard woman to find, Sergeant. I'm not a sergeant anymore. That's not what your DD-214 says. Calloway steps forward. Excuse me, who the hell are you? Garrett doesn't even look at him. Lieutenant Colonel James Garrett, U.S. Army Medical Command. And you are? Dr. Evan Calloway. Attending surgeon. This is my ER. Not anymore. He turns back to Maya. We've got a situation. Fort Bragg Field Hospital is underwater after the hurricane. We're setting up a temporary surgical unit at the Civic Center. I need my best trauma team. I'm not on your team. You were the best combat surgical tech I ever saw. And right now, I've got 200 wounded soldiers and civilians with no OR. Find someone else. There is no one else. Silence. Ortiz steps forward. She saved 6 people tonight, alone. Garrett looks at her. I'm not surprised. He looks back at Maya. I'm not ordering you, Reeves. I'm asking. I left for a reason. I know. Then you know why I can't go back. I'm not asking you to go back. I'm asking you to move forward. Maya's breath catches, and for the first time in 18 months, she stops running. I'll need a team. You'll have one. And full autonomy. Done. She looks at Ortiz, then Calloway. I'm sorry I lied. Ortiz steps closer. Don't be. Just teach us what you know. Calloway says nothing, but he nods. The invisible woman steps into the light. 6:47 in the morning. Hospital conference room. The table is long. Polished wood. Too formal for what this conversation needs to be. Maya sits on one side. Ortiz and Calloway across from her. The hospital administrator, a man named Douglas Chen, at the head. Garrett stands in the corner, silent, arms crossed. The air is thick with unasked questions. Chen adjusts his glasses, clears his throat. We need to understand what we're dealing with, Miss Reeves. It's Sergeant Reeves, or it was. You falsified your application. I didn't lie about my skills. I just left some things out. Calloway leans forward. Like being a combat surgeon, I was never a surgeon. I was a 68 whiskey, combat medic. Then I got selected for the forward surgical team. Ortiz's eyes narrow. Recognition. That's Tier 1. Special Operations Support. Maya nods. I worked in field hospitals, trauma tents. Sometimes just dirt and a tarp. We did damage control surgery under fire. For how long? 8 years, 4 deployments. Silence settles over the room. Chen breaks it. Why did you leave? Maya's jaw tightens. I got tired of losing people. Ortiz doesn't look away. That's not the whole story. No, it's not. Maya exhales. Long, controlled. Kandahar, 2017. We took mortar fire during a mass casualty event. Tent collapsed. Half my team was buried. Her voice is flat. No emotion. Just facts. I pulled 2 of them out. One didn't make it. The other lost both legs. She looks at her hands. I kept working. Kept operating. Saved 11 soldiers that night. Calloway's voice is softer now. That's incredible. I left 3 of my teammates under the rubble because I chose the patients instead. Silence. Command gave me a Bronze Star. I threw it in a drawer and requested discharge. Maya, I couldn't do it anymore. Couldn't choose. Couldn't lose anymore. Her voice cracks. Just slightly. So I walked away. Found a small hospital. Worked. Worked as a tech. Kept my head down. And came here. And came here. Chen shifts in his seat, uncomfortable. You've been practicing medicine without a license. Garrett steps forward. She's been saving lives. That's what matters. It's a liability issue. Then make her an exception. Hire her as a consultant. Do what you have to do, but don't punish her for being the best at what she does. Ortiz doesn't hesitate. I agree. Calloway looks at Maya. Really looks at her. Seeing her for the first time. So do I. Chen sighs, rubs his temples. We'll figure something out. Maya looks at Garrett. I'm not re-enlisting. I'm not asking you to. This is a humanitarian mission. 30 days. After that, you're free. And if I say no, then I'll respect that. But I'm asking you, Reeves. Not as your commander. As someone who knows what you're capable of. Maya closes her eyes. The weight of before. The weight of now. The weight of what she could still do. 30 days. 30 days. And then I'm done. Deal. The meeting ends. Chairs scrape. Papers shuffle. Ortiz lingers as the others leave. Maya stands, gathering herself. I meant what I said. Maya looks at her. About what? Teaching us. We need what you know. I'm not a teacher. You already are. Ortiz leaves. Maya stands alone in the conference room. The morning light filters through the blinds. Soft, golden. She takes a breath, then walks out. 7:30 in the morning. Parking lot. Garrett waits by a black SUV. Engine running. Maya approaches. duffel bag over her shoulder. Everything she owns fits inside. You travel light. Habit. She tosses the bag in the back, climbs into the passenger seat. Garrett pulls out a fillet. The hospital shrinks in the rearview mirror. You didn't have to come. I know. So why did you? Maya watches the city pass by. Buildings, people, normal life continuing like nothing happened. Because you were right. About what? Moving forward. They drive in silence for a while. Then Garrett speaks. I read the after-action report. From Kandahar. Maya doesn't respond. You saved 11 soldiers. Worked for 6 hours straight. Didn't stop, even when the structure was compromised. I did my job. You did more than that. I left 3 people behind. You made an impossible choice, and you've been punishing yourself ever since. Maya's hands clench in her lap. They were my team, and the 11 you saved were someone else's team. Someone else's son. Someone else's reason to keep going. She turns to look at him. Does that make it easier? No, but it makes it worth it. They drive. 8:15 in the morning. Civic Center. The building is massive, concrete, cold, normally used for conventions and community events. Now it's a field hospital. Rows of cots fill the main floor. Surgical stations set up along the walls. Supply crates stacked in corners. Generators humming. The organized chaos of military efficiency meeting civilian desperation. Maya steps out of the SUV. The smell hits her first. Antiseptic, blood, sweat, diesel fuel. The same smell as Kandahar. Her breath catches. Garrett notices. You good? Maya nods, forces herself to breathe. I'm good. They walk inside. A captain approaches. Young, efficient, colonel. We've got 32 critical, 15 stable. OR1 is operational. OR2 will be ready in an hour. Garrett nods. This is Sergeant Weaves. She'll be running trauma intake and coordinating with surgical teams. The captain looks at Maya. No judgment, just respect. Respect, ma'am. Maya nods. Show me the layout. They walk through the space. Maya's eyes scan everything. Triage stations, supply flow, personnel distribution, exit routes. Her mind shifts, clicks into a mode she thought she'd left behind. You need a second decontamination station, and this supply line is too long. Move the crash carts closer to intake. The captain makes notes. Yes, ma'am. And get me a whiteboard. I want real-time patient tracking visible to everyone. Already on it. Maya stops at the edge of the surgical area. A woman lies on a cot. Mid-30s, leg mangled, waiting for OR space. A nurse sits beside her, holding her hand. Maya kneels down. What's your name? Sarah. Sarah, I'm Maya. We're going to take care of you. It hurts. I know. We're getting you into surgery soon. Sarah's eyes fill with tears. Am I going to lose my leg? Maya doesn't lie. I don't know yet. But we're going to do everything we can. Sarah nods, squeezes the nurse's hand. Maya stands. Looks at the nurse. Keep her comfortable. And let me know the second OR2 is ready. The nurse nods. Maya walks back to Garrett. Her face is set, determined. Let's get to work. Day 3. Civic Center Field Hospital. The rhythm has settled into something functional. Controlled chaos replaced by organized precision. Maya moves through the space like she was born to it. She's different here. No longer invisible. No longer hiding. Calloway works beside her now. Watching. Learning. He's been here since day 1. Volunteered without hesitation. You're doing a vascular repair with a staple gun? Field trick. Works when you don't have time for sutures. She closes the vessel. Checks the pulse distal to the repair. Strong. Steady. That's genius. That's necessity. She strips her gloves, moves to the next patient. Calloway follows. He's not the same surgeon who dismissed her 3 days ago. Something shifted. Humility replacing arrogance. Curiosity replacing assumption. How do you prioritize when everyone's critical? You don't save everyone. You save the most you can. That's not in any textbook. Because textbooks assume you have time. Out here, you don't. She stops at a patient with abdominal trauma. Palpates. Listens. This one goes next. Probable liver lack. He's compensating now, but he won't be in an hour. Calloway nods, makes the call. Maya keeps moving. Day 7. Ortiz arrives with a transport van full of supplies. She's been coordinating with County Memorial, sending resources, rotating staff. She finds Maya in the surgical area, hands deep in a chest cavity, repairing a cardiac laceration. Steady hands, steady voice. Clamp. A nurse passes it. Suture. She ties off the repair. The heart beats stronger. He's stable. Close him up. She steps back, lets the resident finish. Ortiz waits until Maya strips her gown. You look like you belong here. Maya washes her hands, doesn't meet her eyes. I used to. You still do. Maya pauses, water running over her hands. I don't know if that's a compliment or a warning. Maybe both. Ortiz hands her a towel. I owe you an apology. You don't. I do. I saw your skill and dismissed it. That was wrong. You didn't know. I should have asked. Maya looks at her. Most people don't. I'm not most people. A pause. When this is over, come back. Teach our residents. Train our trauma team. I'm not a teacher. You already are. Maya doesn't respond, just dries her hands and walks back into the fray. Day 12. The patient load is lightening. Fewer critical cases, more recoveries. The system is working. Maya stands outside during a rare break. The air is cool, clean. She closes her eyes and just breathes. Footsteps behind her. Calloway. He doesn't say anything at first, just stands beside her. I was an ass. Yeah, you were. I'm sorry. Accepted. He hesitates. I've learned more from you in 2 weeks than I did in 6 years of training. You're a good surgeon, Calloway. You just needed to stop thinking you knew everything. Did you ever feel that way? Every day. Until the day I didn't. What changed? I lost someone I should have saved. Silence. Then you learn that confidence without humility kills people. Calloway nods. Thank you. For not giving up on me. I didn't do it for you. I did it for them. She nods toward the building. The patient's inside. But you're welcome anyway. Day 18. A young soldier is brought in. Early 20s. IED injury during a training exercise. Massive trauma. Maya is at his side instantly. She works fast, precise. But there's something different in her movements. Something personal. The soldier's eyes find hers. Am I going to die? Not if I have anything to say about it. She doesn't stop. Doesn't hesitate. 2 hours later, he's stable. Maya sits beside his cot, exhausted. He's asleep now, sedated, safe. Garrett approaches. You saved him. We saved him. You led the team. Don't diminish that. Maya looks at the soldier's face. So young. He reminds me of one of mine, from Kandahar. The one who made it, the one who didn't. Garrett sits beside her. You can't save them all, Reeves. I know, but I can try. Day 25. Garrett finds Maya outside again. She's watching the sunset. Rare moment of stillness. 5 more days. I know. You've saved 43 lives here. We've saved them, not just me. You trained them. You led them. A pause. You could come back. Full commission. Your choice of post. No. I had to ask. I know. He sits beside her. You didn't weave because you were weak, Reeves. I know that now. Good. He stands. Whatever you do next, don't hide. I won't. He walks away. Maya stays, watching the light fade. Day 28. A complication. A patient crashes during what should have been a routine procedure. Maya is in the OR, hands moving, calling orders. The team responds instantly. No hesitation, no doubt. They've learned from her. Trust her. The patient stabilizes. Maya steps back, lets them finish. Calloway meets her outside the OR. You made that look easy. It wasn't. I know. But you never let us see that. Because panic is contagious, so is calm. He smiles. I'm going to miss working with you. You'll do fine without me. Will I? You already are. Day 30. The mission is over. The field hospital is being dismantled. Patients transferred. Equipment packed. Maya stands in the empty space. The cots are gone. The surgical station's broken down. Just concrete and echoes now. Garrett approaches. Ready? Maya nods. Thank you for giving me this. I didn't give you anything. You earned it. She looks at him. I'm not coming back. You know that. I know. But I'm not hiding anymore either. Good. They walk out together. The Black Hawk is waiting. But Maya doesn't get on. I've got a ride. Ortiz pulls up in the hospital van. Calloway in the passenger seat. Garrett smiles. You've got a good team. I do. She shakes his hand. Take care of yourself, Reeves. You too, sir. He climbs into the helicopter. Helicopter. The rotors spin up. Dust swirls. Maya watches it lift off, rise into the sky, disappear. Then she turns. Ortiz leans out the window. You coming? Maya climbs into the back. Let's go home. 2 days after the field hospital closes. County Memorial. Evening. Maya stands outside the main entrance, hands in her pockets, staring at the glass doors. She hasn't been back since she left with Garrett. The building looks the same, but everything feels different. The doors slide open. Ortiz steps out. You going to stand out here all night? Maybe. Come on, we're not going to bite. Maya follows her inside. The hallways are familiar. The smell, the sounds. But the eyes that watch her pass are new. Curious, respectful. Someone nods as she walks by. Another says her name, Sergeant Reeves. She's not used to this. Conference room. Same table, same chairs. But Chen isn't alone this time. 3 board members sit with him, and a woman Maya doesn't recognize. Sharp suit, confident posture. Chen stands. Maya, this is Dr. Rachel Kovach, Chief of Surgery. Kovach extends her hand. Maya shakes it. I've heard a lot about you. Most of it's probably not good. On the contrary, Dr. Ortiz and Dr. Calloway have been singing your praises for 2 weeks straight. Maya glances at Ortiz. She just smiles. Chen gestures to a chair. Please, sit. Maya sits. Ortiz and Calloway take seats on either side of her. Chen opens a folder. We've reviewed your military record, your performance at the Civic Center, and the incident here 3 weeks ago. Maya's jaw tightens. I'm not here to defend myself. You don't have to. We're here to offer you a position. Maya blinks. What? Kovach leans forward. Director of Trauma Education. You'll train residents, develop new protocols, and serve as a senior consultant on complex cases. I don't have a medical degree. You have 8 years of combat surgical experience. That's worth more than a piece of paper. Chen slides a document across the table. We've created an exception, pending your completion of a 10-week accelerated certification program. You'll have full authority to teach and consult. Maya stares at the paper. Why? Kovach doesn't hesitate. Because you're the best trauma specialist I've ever seen. And because our people need what you know. Ortiz speaks up. We almost lost 2 patients in the last 3 weeks because we didn't know what you know. That can't happen again. Calloway nods. You saved my career, maybe my life. Let me return the favor. Maya looks at each of them. I walked away for a reason. We know. And we're not asking you to go back. We're asking you to build something new. Silence. Maya's hands rest on the table. Flat. Still. Then she picks up the pen. Signs. 1 week later. Maya's new office. It's small. A desk. A chair. A window overlooking the parking lot. But it's hers. She unpacks a box. Not much inside. A few books. A coffee mug. And the photo. She sets it on the desk. Facing her. 5 faces. Desert fatigues. Smiling. A knock at the door. Come in. A young resident enters. Nervous. Fresh out of medical school. Dr. Reeves? Just Maya. I'm Dr. Patel. I'm starting my trauma rotation next week. Good. I heard you worked in combat zones. I did. Patel hesitates. Can you teach me? Maya looks at him. Really looks. Sees the eagerness, the fear, the hope. Yeah, I can teach you. His face lights up. Thank you. He leaves. Maya sits at her desk, looks at the photo. I'm still here. Still fighting. He opens her laptop, starts writing a training curriculum. 2 weeks later, trauma simulation lab. Maya stands in front of a group of residents. 10 of them. Young, eager, terrified. A mannequin lies on a table, hooked to monitors, designed to simulate real trauma. You've got a patient with a tension pneumothorax, blood pressure dropping. You've got 2 minutes before he codes. What do you do? Patel steps forward, needle decompression, second intercostal space. Show me. He picks up a needle, hands shaking slightly. Maya watches. Breathe. You're not going to hurt him. He's already dying. You're his only chance. Patel steadies, positions the needle, inserts it. The mannequin's pressure stabilizes. Good. Now what? Chest tube. Correct. Do it. He does. Smooth. Confident now. Maya nods. That's how you save a life. Not by being perfect, by being decisive. The residents take notes. Another steps forward. What if you don't have the equipment? Then you improvise. She picks up a ballpoint pen, disassembles it. Field cricothyrotomy. You use what you have. She demonstrates on the mannequin. The residents stare, fascinated, horrified. I've done this twice. Both patients lived. It's not pretty. But pretty doesn't matter when someone can't breathe. A female resident raises her hand. How do you stay calm? Maya pauses. You don't. Not inside, but you can't let them see it. Panic spreads faster than any infection. She looks at each of them. You will lose patience. That's inevitable. But you will also save lives that no one else could save. That's what makes this worth it. 1 month later, Trauma Bay, real case. A car accident victim. Young woman, severe internal bleeding. Calloway is lead surgeon, but he's struggling. I can't find the source. Maya steps in, gloves already on. Let me see. She palpates, observes. Retroperitoneal bleed. Likely renal artery. How do you know? Flank ecchymosis. Pain pattern. BP drop without visible abdominal bleeding. She positions the retractor differently. There. Calloway sees it now. I would have missed that, but you didn't. Because you asked. They work together. Control the bleed. Repair the vessel. The patient stabilizes. Afterwards, in the hallway, Calloway pulls off his gloves. I almost killed her, but you didn't. Because you were here. I won't always be. Then it's a good thing I'm learning. He smiles. Tired but grateful. 2 months later, evening. Maya's office. She's reviewing case files when Ortiz knocks. Got a minute? Always. Ortiz sits. We've had 0 preventable trauma deaths since you started. That's the team. Not me. It's you. Your protocols. Your training. She pauses. The board wants to expand your program. Bring in surgeons from other hospitals. Make this a regional training center. Maya leans back. That's a lot of responsibility. You've handled worse. Maya looks at the photo on her desk. Yeah, I have. So you'll do it? On one condition. Name it. We name it after them. Ortiz looks at the photo. Your team? Maya nods. They deserved better than what they got. This way, they get to save lives even after they're gone. Ortiz's eyes soften. What do you want to call it? The Forward Surgical Training Initiative. I think that's perfect. 3 months later, hospital auditorium, grand opening. The room is full. Surgeons, nurses, residents, press. A banner hangs behind the stage. Forward Surgical Training Initiative. Maya stands at the podium, uncomfortable in the spotlight, but steady. She speaks. Combat medicine teaches you one thing above all else. Don't give up. The room is silent. You will face situations where the protocols don't work, where the equipment fails, where everything goes wrong. She pauses. In those moments, you have 2 choices: freeze or adapt. She looks at Calloway, at Ortiz, at Patel and the other residents. This program exists to teach you how to adapt, how to improvise, how to save lives when no one else can. She glances at the photo in her hand, brought it with her. It's named after 5 people who gave everything to save others. They're gone, but their legacy lives on in every life we save. Applause fills the room. Maya steps down. Ortiz meets her at the bottom of the stage. You did good. We did good. They walk out together. 6 months after the Civic Center mission, County Memorial. The hospital feels different now. The air carries a quiet confidence, a sense that the people here know what they're doing. Maya walks through the trauma bay, observing, not intervening, just watching. The tell works on a patient with chest trauma. His hands are steady, his voice calm. He calls for a chest tube, positions it perfectly. The patient stabilizes. He looks up, sees Maya watching. She nods. He smiles. That's all the approval he needs. In the hallway, a nurse stops Maya. Dr. Reeves, thank you for the new triage protocols. We've cut our response time by 30%. That's good work. It's your system. It's our system now. The nurse walks away. Maya continues down the hall. Ortiz catches up with her. You see Patel in there? I did. He's ready. He is. They walk together. We've had interest from 4 other hospitals. They want to send their teams here for training. That's good. It's more than good. It's transformational. Maya stops at a window, looks out at the city. A year ago, I was restocking supply carts and trying to stay invisible. A lot changes in a year. Yeah, it does. Ortiz studies her face. You regret it, coming back. No, but some days it's harder than others. The days you remember, the days I can't forget. They stand in silence for a moment. Then Ortiz speaks. They'd be proud of you, your team. I hope so. Trust me, they would. Conference room. Staff meeting. Chen addresses the group. Surgeons, nurses, administrators. Our trauma outcomes have improved 42% since implementing Dr. Reeves' protocols. We've become a model for other institutions. Applause. Maya sits in the back, uncomfortable with the attention. Chen continues. We're expanding the Forward Surgical Training Initiative. Starting next quarter, we'll host monthly intensive courses for regional trauma teams. He looks at Maya. Dr. Reeves will lead the program. She'll have full authority over curriculum and personnel selection. More applause. Maya doesn't smile, just nods. After the meeting, Calloway approaches. You don't like the spotlight. Never have. You're going to have to get used to it. Doesn't mean I have to like it. He laughs. Fair enough. They walk toward the exit. I have a case next week. Complex vascular repair. I'd like you to scrub in. I'm not a surgeon. You're more of a surgeon than most surgeons I know. She considers. All right, send me the file. Already did. He walks away. She shakes her head, almost smiling. 3 months later, simulation lab. Maya runs a trauma scenario. 20 participants. Surgeons from 5 different hospitals. They work in teams, chaos-controlled. Organized precision. A simulated mass casualty event. Multiple patients. Limited resources. Maya watches. Calls out complications. Patient 3 is crashing. Tension pneumo. You've got 90 seconds. A surgeon from another hospital steps forward. Hesitates. What do I do? What would you do if I wasn't here? He thinks, then moves. Needle decompression. Just tube. Clean execution. Good. Next. Another complication. Then another. The teams adapt. Improvise. Support each other. Maya calls time. Everyone stops. She walks through the room. You just saved 14 lives. You lost 2. In a real scenario, those numbers would be reversed without proper training. She stops at the center. That's why this matters. That's why you're here. One of the visiting surgeons raises a hand. How do you train for something you hope never happens? You train like it's already happening, because one day it will. Evening. Hospital cafeteria. Maya sits alone, reviewing case files. Coffee cooling beside her. A shadow falls across the table. She looks up. The man from months ago, the one who recognized her in the break room, the father of the soldier she saved. He's holding 2 cups of coffee. Mind if I sit? It's a free country. He sits, slides 1 cup toward her. Fresh. Yours looks cold. Thanks. They sit in silence for a moment. My son's getting married next month. That's good. He wanted me to find you, to invite you. Maya's hand's still on the file. I don't think that's a good idea. He said you'd say that. He pulls out an envelope, sets it on the table. He also said to tell you that he's alive because you refuse to give up. And that means your family. Maya stares at the envelope. I was just doing my job. Maybe. But you did it when no one else could. He stands. Think about it. The invitation's good whenever you're ready. He walks away. Maya opens the envelope. A wedding invitation. And a photo. The soldier from Kandahar, older now, smiling, standing on prosthetic legs, arm around a woman, alive. Maya's breath catches. She closes her eyes. 1 week later, training center dedication ceremony, a new wing of the hospital, built specifically for trauma education, state-of-the-art equipment, simulation rooms, lecture halls. The ribbon cutting is today. Maya stands beside Chen and Kovac. Press cameras flash. Kovac speaks into a microphone. This facility represents a commitment to excellence in trauma care, and it exists because one woman refused to let her knowledge die with her. She gestures to Maya. Dr. Maya Reeves, former combat surgical specialist, current director of trauma education, and the reason we're all here today. Applause. Maya steps to the microphone. I didn't do this alone. This facility represents the work of dozens of people who believed that saving lives is worth the effort. She pauses. It's dedicated to those who gave everything so others could live. And it's built for those who will carry that mission forward. She cuts the ribbon. More applause. But Maya is already walking inside, away from the cameras, back to the work. 2 weeks later, evening. Maya's office. She's packing up for the day when Calloway appears in the doorway. Got a second? Sure. He enters, looks nervous. I had a case today. Delayed pneumothorax, just like you called 6 months ago. Did you catch it? I did, because you taught me what to look for. He sits. I saved him, Maya. Good. No, you don't understand. 6 months ago, I would have missed it. He would have died. And I would have had no idea why. He looks at her. You didn't just teach me a skill. You changed how I see patients, how I think. That's what good training does. It's more than training. It's a legacy. Maya doesn't respond. Calloway stands. I just wanted to say thank you for not giving up on me when I was an arrogant ass. You weren't that bad. Yes, I was. She smiles, just slightly. Yeah, you were. He leaves. Maya sits alone in her office. The photo on her desk. The 5 faces. She touches it gently. Still here. Still fighting. Still saving lives. 3 months later. Trauma Bay. Late night. A mass casualty event. Building collapse. Multiple victims. The bay floods with patients. But this time, it's different. The team moves like a machine. Triage. Prioritization. Treatment. No hesitation. No panic. Patel leads one team. Another resident leads another. Calloway coordinates. Ortiz supervises. Maya watches from the observation deck. They don't need her anymore. Ortiz joins her. Look at them. I am. That's your doing. That's their doing. I just showed them the way. You built this. We built this. They watch in silence as the team save life after life. Organized, efficient, compassionate. Ortiz speaks quietly. You're not invisible anymore. No, I'm not. How does it feel? Maya considers. Terrifying. And right. Good. Because we're not letting you go. Maya smiles. I'm not going anywhere. Below, a patient stabilizes. Then another. The monitors beep steady rhythms. Lives saved. Futures secured. And in the corner, barely visible, a plaque on the wall. In honor of those who serve in silence. Maya reads it from above. Not silent anymore. 2 years later. County Memorial Hospital. The conference room is full. Residents in the front rows. Attending surgeons along the sides. Nurses standing in the back. Visiting physicians from across the state. At the front of the room, Dr. Maya Reeves. Not sergeant, not tech. Doctor. She finished her accelerated medical degree, passed her boards, got her license. But more than that, she found her place. The projector displays a chest x-ray. Tension pneumothorax. Clear as day to anyone who knows what to look for. Maya uses a laser pointer. Notice the tracheal deviation, the mediastinal shift. These are your indicators. You've got minutes, not hours. A young resident raises her hand. What if you don't have imaging? Then you use your hands, your eyes, your training. She switches slides. Field photographs. Desert. Tents. Combat medicine. I've diagnosed and treated this condition in the back of moving vehicles, under mortar fire, with nothing but a penlight and a stethoscope. The room is silent. You have more resources than I ever did. Use them, but don't depend on them. Another hand. How do you stay calm when everything's falling apart? Maya pauses, considers the question. You don't, not inside, but you control what they see. Because fear spreads faster than any hemorrhage. She looks at each face in the room. You will lose patience. That's inevitable. You will make mistakes. You will face situations where nothing in your training prepared you. She advances the slide, a quote. In those moments, you have 2 choices, freeze or adapt. The words hang in the air. This program exists to teach you how to adapt, how to improvise, how to save lives when the protocol fails. Patel sits in the front row, no longer a nervous resident, now a confident trauma surgeon. He nods. Calloway stands against the wall, arms crossed, listening, learning, still. Ortiz sits beside Kovac, both watching Maya with something like pride. Maya closes her presentation. Questions? Dozens of hands shoot up. She answers each one. Patient. Thorough. Drawing from years of experience earned in blood and sand. After the lecture, the room empties slowly. People linger. Want to talk. Want to learn more. Maya packs her materials. A young nurse approaches. Dr. Reeves, I just wanted to say thank you. Your protocol saved a patient last week. I would have missed the signs without your training. What did you see? Subcutaneous emphysema. Respiratory distress. I called it early. Good work. The nurse beams, walks away. Patel approaches next. That was a great lecture. You've heard it before. Doesn't mean it's not worth hearing again. He hesitates. I got an offer. Trauma director position at City General. That's a good opportunity. I'm terrified. Maya looks at him, really looks at him. You're ready. You've been ready for months. What if I fail? Then you learn, and you do better next time. She puts a hand on his shoulder. I trained you. I don't train people who fail. He smiles. Thank you for everything. You earned it. He leaves. Maya gathers her things. Calloway approaches. Drink? Can't. Meeting with the board in an hour. They want to expand again? Always. They walk together toward the exit. You remember when you told me I was an arrogant ass? I remember telling you that last week. He laughs. Fair, but I mean the first time, 2 years ago. I remember. I've been thinking about that moment a lot lately. Why? Because it changed my life. They stop at the elevator. I was a mediocre surgeon pretending to be great. You showed me what great actually looks like. You did the work. You showed me how. The elevator arrives. They step in. I'm putting your name forward for department head. Maya turns to him. I don't want that. You'd be perfect for it. I'm perfect for what I'm doing now. Training, teaching, saving lives through other people. Calloway nods. All right, but the offer stands. Noted. Evening. Maya's office. She sits at her desk, laptop open, writing another training module. The photo is still there. 5 faces. But now it's surrounded by others. Pictures of residents who graduated, patients who survived, teams she trained, a wall of lives saved. A knock at the door. Come in. Ortiz enters, 2 cups of coffee in hand. Thought you could use this. Thanks. Ortiz sits. They drink in comfortable silence. The board approved the expansion. We're doubling the training capacity. That's a lot of people. That's a lot of lives. Maya nods. I got something in the mail today. She pulls out an envelope, opens it. Inside, a photo. A wedding. The soldier from Kandahar. His wife. 2 small children. And a note. Thank you for giving me this. You'll always be family. Ortiz looks at the photo. You gave him a future. We gave him a future. No, you did. In a tent. Under fire, when no one else could. Maya sets the photo on her desk. Next to the others. That's why I do this. So other people can have futures. They sit quietly. Then Ortiz speaks. Do you ever regret leaving the military? Maya considers. I regret the people I lost. But I don't regret the choice. Why not? Because I'm saving more lives now than I ever did in uniform. She gestures to the photos. Every person I train saves dozens of patients, maybe hundreds. So that's a legacy I can live with. Your team would be proud. I hope so. I know so. 1 month later, hospital auditorium, graduation ceremony. 40 trauma specialists completing the intensive program, ready to return to their hospitals, ready to save lives. Maya stands at the podium. 2 years ago, this program didn't exist. Today, it's trained over 200 specialists. Those specialists have saved thousands of lives. She pauses, but the work isn't done. It never is. She looks at the graduates. You're going back to your hospitals with knowledge that most people will never have. Use it, teach it, pass it on. She holds up a patch. The Forward Surgical Training Initiative logo. This patch represents a promise. The promise that you will not give up, that you will adapt, that you will save lives when no one else can. She hands the patches to Patel and Calloway. They distribute them to the graduates. Each person stands as they receive theirs. Pride on their faces. After the ceremony, Maya stands outside, watching the graduates leave, heading back to their hospitals, their communities, their patients. Ortiz joins her. You did good. We did good. Ortiz smiles. You keep saying that. Because it's true. A car pulls up. Garrett steps out. Maya wasn't expecting him. Colonel. Doctor. He smiles at the title. I heard you graduated another class. Word travels. I wanted to see for myself. They walk together. The Army could still use you. The Army has plenty of people. These hospitals need me more. Can't argue with that. He stops, looks at the building. You built something important here. We built something important. He laughs. You really don't take credit for anything, do you? Not when it's a team effort. They stand in silence. Then Garrett speaks. Your team would be proud. What you've built. The lives you've saved. Maya looks at the sky. Clear. Blue. I carry them with me. Every day. I know. That's what makes you great. He shakes her hand. Keep doing what you're doing, Reeves. I will. He gets back in his car, drives away. Maya stands alone, but not really alone. 3 months later, Maya's office, late evening. She's reviewing case files when her phone buzzes. A text from Patel. Used your field technique tonight. Saved a patient everyone thought was gone. Thank you. She smiles. Texts back. You did the work. Proud of you. She sets the phone down. Opens her desk drawer. Inside, the bronze star. Still in its case. She takes it out. Looks at it. For the first time in years, she doesn't feel guilt. Just pride. She sets it on the desk. Next to the photos. Stands. Looks out the window at the city. Lights glowing. Lives continuing. Somewhere out there, someone she trained is saving a life. And tomorrow, she'll train someone else to do the same. The young surgeon ignored her warning until his patient crashed, and her field trick saved him. But the real trick was never giving up. Not on the patient, not on herself, not on the fight. Maya turns off the light, walks out. The photo on her desk catches the moonlight. 5 faces, still smiling, still with her, always. She closes the door. The hallway is quiet, but in the trauma bay, monitors beep. Patients breathe. Lives continue. Because she refused to quit. Because she taught others to do the same. And that legacy will outlive them all. For the medics, the techs, the surgeons who serve in silence, who save lives in the dark, who never give up. Thank you.